Hello, and welcome to this week's episode of Medisodes. This week, we're going to be talking about pneumonia. And to start off with, we're going to go to Surya, who's going to be talking about the symptoms of pneumonia.
Pneumonia is the swelling or inflammation of the tissue in one or both of the lungs. It's usually caused by a bacterial infection. It can also be caused by a virus. The symptoms of pneumonia can develop suddenly over 24 to 48 hours, or they may come on more slowly over several days. Common symptoms of pneumonia include a cough, which may be dry or produce thick yellow mucus, which is also known as phlegm. You could also experience difficulty in breathing, where your breathing may be rapid and shallow, and you may feel breathless even when resting. Rapid heartbeat, high temperature, feeling generally unwell are all common symptoms, as well as sweating and shivering, and this may be accompanied by a loss of appetite. Chest pain is also a common symptom of pneumonia, which can get worse when breathing or coughing. Less common symptoms include coughing up blood, headaches, fatigue, or feeling sick in general, and as well as wheezing, joint and muscle pain, as well as feeling confused and disorientated. This symptom is particularly common in elderly people. Now that we've had a brief overview of the symptoms of pneumonia, now on to Shrey, who will be looking at the causes of pneumonia and groups of people who are most at risk of pneumonia.
There are four main ways that pneumonia can be acquired, and that's from bacteria, viruses, fungi, and through aspiration. Between 5 and 11 people per thousand get pneumonia every year in the UK. And by far the most common is bacterial pneumonia. The most common bacteria species are Streptococcus pneumoniae, Haemophilus influenzae, and Legionella pneumophila, which causes walking pneumonia, which is characterized by fatigue. Bacterial pneumonia infects the lungs by colonizing the alveoli and the bronchioles, which are the air sacs and the branches nearest to where gas exchange happens in the lungs. And this causes an inflammatory response with white blood cells, proteins, and fluid all filling the lungs. Build-up of fluid is pneumonia. If we look at who's most at risk from bacterial pneumonia, it's older people, 65 plus, and babies and young children, because their immune systems are not 100%. And also people with chronic conditions such as asthma, diabetes, heart disease are also at risk. Those recovering from surgery, those who are nutritionally deprived, who don't have enough vitamins and minerals, those who smoke, and those who abuse alcohol and drugs. Also within those with weakened immune system also are very at risk from bacterial, as well as other forms such as people with organ transplant, people with HIV, and those who have progressed to AIDS, cancer, especially those on chemotherapy. Pollution can also be a risk factor, as we mentioned in our episode about health in the city. There's also mycobacterium such as tuberculosis, which also are a key cause of bacterial pneumonia. There are two main settings where pneumonia can be acquired, and that's community-acquired pneumonia, also known as shortened to CAP, which is pneumonia acquired outside the hospital in the community, and these are generally easier to treat. And then there's hospital-acquired pneumonia, also known as nososocial infection, and these generally are a bacteria that are resistant to antibiotics, such as MRSA, which is methicillin-resistant Staphylococcus aureus, and these are much more dangerous because it's much harder to treat them without antibiotics, as you'll know from our episode about antibiotic resistance. Viral pneumonia is also pretty common, and this is caused by viruses traveling through the air when people cough, sneeze, and when they land on surfaces. And the viruses get in through the nose and mouth. The most common viruses are influenza A and B, and these are the most common in adults. And there's also respiratory syncytial viruses, RSV viruses, which affect infants and children. Also, of course, COVID-19 can also cause pneumonia. We've done many episodes on COVID-19. Please check them out. There's also rhinoviruses and adenoviruses, which are also pretty common. And there's also, more rarely, measles and chickenpox can also cause pneumonia. Moving on to aspirational pneumonia. This is definitely not a type of pneumonia you want to aspire to. It's caused by inhaling food, stomach acid, saliva into the lungs. So the bacteria from these places are carried to the lungs, where they can infect it and cause pneumonia. And aspirational pneumonia is most common around those with swallowing disorders or those who abuse drugs and alcohol. Fungal pneumonia is quite rare in the UK, and it mostly affects people with weakened immune systems, such as those who have HIV, AIDS, or have had organ transplants. And it's caused by fungal spores in the air, soil, and clinical environment, which are inhaled, and then they go into the lungs and infect it. The most common fungi are Pneumocystis jirovecii, also known as PCP, which is very common in people with HIV, Cryptococcus, and Aspergillus. Pneumonia can also be caught in hospitals, especially for people on ventilators, because microbes from the tube that is used to ventilate them can migrate into the lungs, causing pneumonia. And this has been seen during the COVID-19 pandemic. It's important to make sure the ventilators are properly cleaned to make sure that there's no bacteria that can infect the person. Now that we looked at how pneumonia can be acquired and caused, let's move on to Adrian, who's going to talk about the stages of pneumonia.
So we tend to refer to pneumonia as a single disease, but its progression and development over time is so complex that its development has been split into 4 separate stages. As with any disease whose progression has been split up into distinct stages, these stages form part of a continuous disease cycle, and are only there to simplify the disease to make it easier to understand and study and diagnose, of course. So, the first stage of pneumonia is called congestion or consolidation. During this phase, infectious fluid that has accumulated in the air sacs causes the lungs to become very heavy and congested. This stage happens within the first 24 hours of contracting pneumonia, and a patient may experience early pneumonia symptoms such as coughing, a heavy feeling in the chest, a loss of appetite, fatigue, and rapid breathing. Many bacteria are present in the lungs, but few white blood cells are available to fight the infection. During this stage, the alveolar air capacity is reduced as they are filled by lymphocytes and fibrin. The second stage of pneumonia development is called red hepatization. Red blood cells and immune cells that enter the fluid-filled lungs to combat this infection give the lungs a red appearance. Although the body has started to fight the infection now, the patient's symptoms may gradually be worsening, including a shortness of breath, muscle aches, fever, sweating, and blue lips or fingernails. This stage is often the most dangerous, due to the lungs' reduced capacity, small alveolar surface area, and thus reduced oxygen in the blood. And if a person spends too long in this stage, it may mean they need medical attention and intervention before they are oxygen starved. This stage occurs after 2 to 3 days of the infection first settling in, and lasts for about 2 to 4 days. The affected lungs becomes drier, granular, and airless, to resemble the consistency of the liver, hence the name hepatization. In this stage, the lungs become hyperemic, which means that there is an excess of blood in the vessels supplying the lungs as the body tries to deliver more white blood cells to counter the infection. The next stage of pneumonia is grey hepatization. In this stage, the lung looks greyish in colour, with the consistency of the liver remaining. The reddish colour of the lungs from the previous stage, red hepatization, is lost as fibrin and especially red blood cells break down, leading to a more fluid-like exudate. Macrophages, a type of large white blood cell, start to form in response to the growing threat of bacterial infection. Alveolar macrophages are critical for tissue homeostasis, host defense, clearance of cell debris, pathogen recognition, and several other lung conditions. And the final, fourth stage of pneumonia development is resolution. This is the final recovery stage and occurs generally between days 8 and 10. Fluids and breakdown products from the cell destruction are reabsorbed. Macrophages produced during the previous grey hepatization stage are present and help to clear remaining white blood cells and remaining debris. It's at this stage that the patient may start to cough up this debris. The airways and air sacs return to normal lung function as much as possible, and any remaining lung swelling may lead to chronic lung diseases, such as airway narrowing or pleural adhesions. Of course, though it sounds like this stage is the end of pneumonia, given its name resolution, it only resembles the end of the infection or the bacteria that's in the lungs. Most of the long-term conditions that are caused by pneumonia are as a result of the lungs not being able to return completely to normal function and being caused permanent damage by the extreme immune response that is required to overcome the severity of the infection. These stages are just a general guide for how the complete cycle from infection to recovery in a patient with pneumonia is. To go through this whole cycle from infection to recovery, a patient's lungs and immune system must be sufficiently robust so that they do not have any serious complications by the end of the cycle. Pneumonia affects a disproportionately large number of older people and extremely young children, whose lungs may not be as robust as others. As such, pneumonia often results in life-threatening conditions and complications. That sadly means that many people die from pneumonia-related causes. And of course, with all the issues that pneumonia causes, treatments and prevention methods are extremely important in helping these patients. And for that, I'll hand over to Anupam.
In most cases, pneumonia is actually quite mild and can be treated at home by getting plenty of rest, taking antibiotics if it's likely to be caused by bacterial infection. Of course, you must finish that prescribed course unless a healthcare professional tells you otherwise. For more on why, see Medisodes episode 10, as well as drinking plenty of fluids. As a general guide, after about 1 week, your high temperature should have gone. After 4 weeks, chest pain and mucus production should have substantially reduced. After 6 weeks, your cough and breathlessness should have substantially reduced. After 3 months, most symptoms should have resolved, but you may still feel very tired or fatigued. But after 6 months, almost all people will feel back to normal after having pneumonia. Especially if you do not have any other health problems, you should respond well to treatment and soon recover, although your cough may last for some time. Symptoms may not improve, however, if the bacteria causing the infection is resistant to antibiotics. A GP may prescribe a different one, or they may prescribe a second one for you to take with the first one. Or a virus could be causing the infection rather than a bacteria. Of course, antibiotics have no effect on viruses, and your body's immune system will have to fight the virus itself by creating antibodies. For at-risk groups, pneumonia can be quite severe and may even need to be treated in hospital. This can be because it leads to serious complications, which are, in some cases, fatal. So what treatments can they give in hospital? Well, they will give you antibiotics, just like at home. However, if you're too ill to drink and take tablets, they can have fluids and antibiotics taken through a drip in your arm. You'll also be given oxygen if you need it. Hospital staff regularly check your temperature and breathing to monitor your situation. You'll usually be given 2 different kinds of antibiotic at the same time, usually for 5 to 7 days, but possibly up to 10 to 14 days. You won't necessarily have to stay in hospital for the full time, though. You will probably not be given antibiotics if the cause is likely to be a virus, such as the coronavirus. This is because antibiotics do not work for viral infections. You will still be given fluids intravenously through a drip, and may still need oxygen to help in breathing. In serious cases of pneumonia, breathing assistance through a ventilator in an ICU or intensive care unit may be required. But I mentioned there are also complications caused by pneumonia. These include pleurisy, where the pleura, which are thin linings between your lungs and rib cage, a membranous sort of tissue, become inflamed, leading to chest pain, as they prevent the lungs from fully expanding during breathing. If you have pleurisy,
you're more likely to develop the next complication, fluid on the lungs. About 1 in 10 people with pneumonia develop fluid around the lung, called a pleural effusion, and this liquid can become infected. They may require a sample of the fluid to be taken by inserting a needle between the ribs under local anesthetic, and if infected, you'll likely need a longer course of antibiotics. Occasionally, they'll even insert a permanent tube to remove fluid as well. Of course, they will remove it once the treatment is over. Other rarer complications include lung abscesses, which is mostly seen in people with a serious pre-existing illness or history of alcohol misuse, blood poisoning, also called septicemia, where the infection spreads from the lungs to the bloodstream. This can also cause low blood pressure and a severe illness that might need intensive care treatment. And finally, the rarest but most dangerous of all, respiratory failure, where the pneumonia causes such low levels of oxygen in the blood, even in people who are given oxygen, that they need to be in intensive care to be treated. And in most cases, it can lead to death. So we've talked all about how pneumonia is treated after being infected. But what are people doing to prevent people from being infected? Well, there are a variety of methods, some low cost, some national and much more expensive. But they include vaccination, environmental measures, and appropriate treatment of other wider health problems. In fact, it's believed that if appropriate preventative measures were instituted globally, mortality among children could be reduced by 400,000, and if proper treatment were universally available, childhood deaths to pneumonia could be decreased by another 600,000. That's almost 1 million people saved if proper measures were instituted around the world. But what are these proper measures? Although most cases of pneumonia are bacterial and are not passed on from one person to another, good standards of hygiene will still help prevent germ spreading. For example, you should always cover your mouth and nose with a handkerchief or tissue when you cough and sneeze. Throw away used tissues immediately. This is because germs can live for several hours on these surfaces, even after they leave your nose or mouth. Also make sure to wash your hands regularly to avoid transferring germs to other people or objects. Another big prevention method, one that's usually instituted nationally, is vaccinations. Vaccines are available to prevent some types of pneumonia and the flu, although they will not prevent all of them. Talking with your local GP will usually let you find out what sort of vaccine you're being given and what sort of pneumonia it's aiming to prevent. Guidelines change over time, so make sure to review your vaccination status regularly, even if you've had a pneumonia vaccine before, as it may be targeting a different strain of disease. Doctors recommend a different pneumonia vaccine for children younger than age 2 than for those children aged 2 to 5 who are at a particular risk of pneumococcal disease. Children who attend group centres, schools, or nurseries should also get the vaccine, as these places can be hotbeds for infection spreading. Immunization against other diseases such as pneumococcus, measles, and whooping cough are also effective to prevent pneumonia. But on a more basic level, adequate nutrition is key to improving children's natural defenses. Things such as exclusive breastfeeding for the first 6 months of life are actually very effective in preventing pneumonia and also helps reduce the length of illness even if the child does become ill. Other environmental factors in a place where people grow up, such as indoor air pollution, can be reduced by providing affordable, clean indoor stoves, and encouraging good hygiene in crowded homes also reduces the number of children who fall ill with pneumonia. The cessation of smoking and reducing indoor air pollution, such as that from cooking indoors with wood, crop residues, or dung, are highly recommended. In fact, smoking is the single biggest risk factor for pneumonia in otherwise healthy adults. All in all, pneumonia is a surprisingly deadly disease, which is often underestimated by many. And while it can be prevented with simple interventions and treated with low-cost, low-tech medication and care, it still affects children and families everywhere, but is most prevalent in South Asia and Sub-Saharan Africa, places where treatment may not be so readily available.
Thank you for listening to this week's episode of Medisodes. I hope you enjoyed it, and that you come back for next week's episode. Thank you.